Intraureteral Indocyanine green dye for intraoperative localization of the ureters. The authors have no conflicts of interest to disclose. This video will briefly review iatrogenic ureteral injuries and modes of prevention. We will demonstrate the technique of intraureteral ICG dye and show its utility in a difficult surgical case. Iatrogenic ureteral injury represents an uncommon but serious complication of gynecologic surgery. Sequelae can be severe, including urinoma or abscess formation, development of urogenital fistulae, and permanent renal compromise. Risk factors for ureteral injury include those that distort anatomy and those that cause periureteral fibrosis. The risk of injury may also be higher in minimally invasive compared to open surgical approaches, with less tactile feedback and a greater reliance on visual cues. Prevention and early recognition of ureteral injuries are essential. Cystoscopy is commonly used for intraoperative injury recognition, but cannot prevent injuries from occurring. Ureteral stents have been shown to reduce the likelihood of ureteral injury. Stents can be palpated intraoperatively, though utility is greater in open than in minimally invasive approaches. Lighted ureteral stents provide an additional visual cue, but cost and availability can be barriers to use. Indocyanine green is a fluorescent dye that can be visualized under near-infrared light. Many surgical applications have been described. Its ability to penetrate tissue and high signal-to-noise ratio make it ideal for ureter localization intraoperatively. The safety profile is excellent. Required materials include a 21 French 30-degree cystoscope with deflector bridge, 2 6 French ureteral catheters, a ureteral guide wire, 25 milligrams of ICG dye dissolved into 10 milliliters of sterile water, a syringe for injection, and finally, a laparoscope with near-infrared capability. Preoperative cystoscopy is completed. With the aid of the deflector bridge, a guide wire and ureteral catheter are inserted into each ureter. The catheters are inserted to a depth of 15 to 20 centimeters. The guide wires are then removed. (2.5 to 5 milliliters of the ICG dye solution are injected into each catheter. The ends of the catheters are then clamped to prevent leakage of ICG dye via the catheters during the case. Intraoperatively, a near-infrared laparoscopy mode can be applied to visualize the ureters. Here, the retroperitoneal space is entered, dissecting parallel to the infundibulopelvic ligament. The ureter can be seen clearly. The IP ligament is isolated away from the ureter for safe transection. We now present the utility of intraureteral ICG dye in a challenging surgical case. This 66-year-old woman has a history of endometrial stromal sarcoma. She was diagnosed after undergoing TAH-BSO for postmenopausal bleeding and fibroid uterus. Surveillance CT scan subsequently identified an enlarged left external iliac lymph node, which was highly concerning for recurrence. The enlarged lymph node is seen highlighted in yellow. The external iliac artery and vein are just adjacent to it. The patient was brought to the operating room for resection of this enlarged node. The lymph node can be seen here. It is quite adherent to surrounding structures, including the ureter and external iliac vessels. The lymph node can be seen more clearly after some dissection. The exact location of the ureter relative to the node is not clear. With gentle dissection, we begin to see green fluorescence. Knowing the location of the ureter, we can carefully dissect the ureter away from the node. The ureter is swept medially away from the lymph node. Continued dissection frees the node from the ureter. Here the node is seen partially dissected away from surrounding structures. The external iliac artery and vein are seen here. The ureter has been dissected away from the node and can be seen peristalsing. Further dissection freed the node completely, allowing for safe removal. In conclusion, intraureteral ICG offers a simple, effective, and safe method for ureter localization in minimally invasive surgery.